Okay, the patient's bed is already in high Fowler's position and risen to my height. Normally, of course, it would be lowered when I entered the room. I have already reviewed the physician's orders. I would know the NG type, the tube type, and the reason for placement. And then walking into the room, I would verify the patient's name and date of birth, and then any allergies. And I would wash my hands first. Then I would view for the oral cavity and any deviations in the nose. Okay. And then I would also check the strength of breathing, including one nostril at a time. All right. And then next, after assessing that, we'll just assume that she breathes normally out of each nostril. I would measure my NG2. Okay, so starting at the top of the nostril that I'm going to use, back behind the ear, then down to the xiphoid process, and then I mark it with a piece of tape. Okay. Alright, now I would go ahead and place a towel and put on my gloves. Alright, I'll go ahead and lubricate the end for about 4 inches. And put the head back and warm your patient. And then start, curve it up towards the ear. Okay, and then I would check the coiling within the mouth with a pen light. Alright, no coiling. And then I would give the patient normally a cup of water to help them with swallowing while entering it afterwards. Okay, so I would enter more, swallow, and so forth until it reaches my tape, which it doesn't go all the way down mannequin in this case. But once it reaches the tape, I would go ahead and tape it to their cheek just temporarily. Actually, I'm sorry, I would, after raising the head and going towards the ear, sorry, the tape's not sticking, I would actually put the head forward to go down the rest of the way while they swallow. And then I would tape it, which it's not sticking in this case very well, but, okay, so I would go ahead and check again if it's coiling in the back of the throat, assuming it's not. I would see if the patient can speak, and then I would insert a syringe and aspirate about 10 milliliters. Then I would check the pH. Okay. Then I would move my towel, of course assuming that's still on the cheek. Then I would listen as I push back the remaining contents in the left upper quadrant, so over their stomach, to listen for the noise. There we go. Okay. And then after that, I would also get an x-ray that's the best way to ensure proper placement. So after that, I would take it off of their cheek. Okay, and then I would tape it to its permanent position. So up on the bridge of the nose, I'm using a butterfly technique. Assuming it's in the nose still. Again, my tape's not sticking in this case very well. And then I would use one more piece to bridge across the nose. Okay. And then I would use a safety pin and a rubber band to just fasten it to the shirt. And just to give slack so they can turn their head without pulling it indeed out. Alright, and then that's placement. Okay. And then I would go ahead and document the, let's see, I would document the length of the tube, the size, the type, color of the contents, the amount of contents that I pulled out, and any patient teaching I taught, and then any, I think that's it. Oh, and the client response, I'm sorry. And that would be it for inserting me in G2. I would then lower the bed and, of course, make them in a more comfortable position, but at least having the head up to 30 degrees. And that's it. Thank you.